Bear the Pam here. Welcome to the final installment in our mini mental health series on delusional disorder. And in this segment, we are going to be covering the diagnosis and treatment of delusional disorder. But before we begin, let me remind you to watch the full video because in the video there will be 3 key words. I will say what the key word is, and at the end of the video in the comment section, put down, along with a genuine comment about the video, the 3 keywords mentioned to be eligible for my free merch giveaway when I reach 2,000 subscribers. So let's get started. You ask, how is delusional disorder diagnosed and treated? Well, if you have symptoms of delusional disorder, your doctor will likely give you a complete medical history and physical exam. Although there are no lab tests to specify diagnose delusional disorder, the doctor might use diagnostic tests such as imaging studies or blood tests to rule out any other physical illness as a cause of the symptoms. These include Alzheimer's disease, epilepsy, obsessive-compulsive disorder, otherwise known as OCD, keyword delirium, or other schizophrenia spectrum disorders. If the doctor finds no physical reason for the symptoms, then they might refer the person to a psychiatrist or a psychologist, which are healthcare professionals trained to diagnose and treat mental illnesses. They'll use interview and assessment tools to evaluate the person for a psychotic disorder. The doctor or therapist bases the diagnosis on the person's symptoms and their own observation of the person's attitude and behavior. Then they'll decide if the symptoms point to a disorder. A diagnosis of delusional disorder is made if the person has 1 or more delusions that last a month or longer. The person has never been diagnosed with schizophrenia, and hallucinations, if they have them, are related to the themes of their delusions. Apart from the delusions and its effects, their life isn't really affected. Other behavior isn't bizarre or odd. Manic or major depressive episodes, if they've happened, have been brief when compared with the delusions. There isn't another mental disorder, medication, or medical condition to blame. After doing all that, and if they find that the person does have delusional disorder, then they'll recommend different treatments. Most treatments include medication and psychotherapy. Delusional disorder can be very difficult to treat, though, in part because those who have it often have poor insight and do not know there's a psychiatric problem. Studies show that close to half the patients treated with antipsychotic medications show at least partial improvement. The primary medications used to attempt to treat delusional disorder are called, keyword, antipsychotics. Drugs that are used include conventional antipsychotics, atypical antipsychotics, and other medications. Psychotherapy can also be helpful along with medications as a way to help people better manage and cope with the stresses related to their delusional belief and its impact on their lives. Psychotherapies may be helpful in delusional disorder include individual psychotherapy, which can help the person recognize and correct the thinking that has become disordered. Cognitive behavior therapy, or known as CBT, can help the person learn to recognize and change thought patterns and behaviors that lead to troublesome feelings. And family therapy, which can help families deal with loved ones who have delusional disorder, enabling them to help the person. People with severe symptoms or who are at risk of hurting themselves or others might need to be hospitalized until the condition is stabilized, though. So what are the complications, if there is any, with delusional disorder? Well, people with delusional disorder might become depressed, often as a result of the difficulties associated with the delusions. Acting on the delusions can also lead to violence or legal problems. For an example, a person with the erotomanic delusion who stalks or harasses the object of the delusion could be arrested. Also, people with this disorder can become alienated from others, especially if their delusions interfere with or damage their relationships. So, what is the outlook for people with delusional disorder? Well, that varies depending on the person, the type of delusional disorder, and the person's life circumstances, including the presence of support and willingness to stick with treatment. Delusional disorder is typically, keyword, a chronic ongoing condition. But when properly treated, many people can find relief from their symptoms. Some recover completely, while others have bouts of delusional beliefs with periods of remission, which is lack of the symptom. Unfortunately, many people with this disorder don't seek help. Why? It's because it's often hard for people with a mental disorder to know they aren't well. Or they may credit their symptoms to other things, like the environment. They also might be too embarrassed or afraid to seek treatment. Without treatment, though, delusional disorder can be a lifelong illness. Well, is there any way that we can prevent delusional disorder? There's got to be some way that we can prevent it, right? Well, unfortunately, there's no known way to prevent delusional disorder, but early diagnosis and treatment can help lessen the disruption to the person's life, family, and friendships. So, that's it about delusional disorder. Remember, everybody, as that stated, a lot of people who have a mental illness don't realize they have a mental illness. To them, they're not acting different. To them, everything's fine. We can see it. Sometimes they can't. So if we're out there judging them instead of trying to help by saying, look, understanding what they're going through, and understanding that there may be a mental illness behind their actions, in trying to help them to solve it, then we're not much of a friend, are we? We were put on this earth to help one another. We were created to need one another. That's why people that live by themselves are unhappy, because they don't have the interaction. We were made to interact with others. That's how we were created. Now, it's up to us on how we interact. If we see with our eyes and judge with our eyes, we could be judging wrongly. We could be saying something that we may not think is serious and it's, just a little joke. But to the person on the other end of that could be the last straw that breaks the camel's back, because we don't know what their day was like, their week, their month. We don't know what is going on inside their head. And believe me, a lot of these, even with delusional disorder, you can see the difference in the brain pattern. Okay? A lot of the mental disorders, they're called mental disorders because it affects the brain. And a normal brain looks a certain way. But a person with different type of mental disorders is wired differently. It does not look normal because it isn't normal. So to sit there and say something that we could think is harmless could be this what makes them go and kill themselves. Because we don't know if they were at that edge before we spoke or not. Our words could be a two-edged sword. It's up to us on how we deal with people and how we talk to others. I know myself, if I was to say something, even in a joking fashion to somebody about something that was going on with their life, and I found that that person committed suicide, I would not be able to live with myself. I would feel so guilty because it might have been what I said that pushed them over the limit. But on the other hand, if we see with our heart and we speak from the heart, because that's what matters, instead of saying something that might push them over the edge, we could say something that might inspire them or encourage them and lift them up and be that life-saving grace that they needed to know that they matter. Because believe me, none of us on this earth are perfect. And what is normal anyway? What could be normal to one person may not be normal to somebody else. Everybody's definition of normal is different. So who are we to say anything about somebody? But remember what I just said. We don't know what they're going through. They could be having a moment, and as this state, mental illnesses isn't just that delusional disorder. It comes with other mental illnesses that it causes, anxiety, depression, and those two things there's a high risk of suicide. So what you say can kill somebody or can lift them up. So if you see with your heart and not your eyes, you'll be able to lift up them people and inspire them. Be their saving grace. Because remember, what the eye see doesn't count. It's just flesh. We see colors, skin. But is that the person? It's just like when you see a shell, like a walnut. You see a walnut, it's brown on the outside, but when you crack that shell open, that walnut's different shapes, right? Kind of looks like a brain if you think about it, but it's good. Chestnuts, acorns, even books. Things aren't what they seem if we just look from the outside. When you look with the heart, you see what matters. Because just like the nut, the shell doesn't matter. Who cares about the shell? You really want the meat, right? The nut. That's what counts. It's the same thing with the person. What we see with the eyes is just the shell. That's all this is a shell. Okay? What matters, the eyes can't see. Only the heart can. Because that's inside the shell. And that the heart is the eyes to the soul. And when you see with your heart, you truly see inside of a person. And you can see what type of person they are. Then you can make fact-based decisions, wise decisions, loving decisions. And you can help people better. It's much better to see from the heart than from your eyes. Believe me, I've had people with my bad eyesight where I'm visually impaired. They see me reading something, and I've had many people come up to me. Oh, I feel so bad for you. I am so sorry. I want to donate my eyes to you. You know what I tell them? Don't bother. I don't need your eyes. I have something better than these. And that's my heart. I don't pretend to be somebody I'm not. What you see here and what I talk about, the way I feel, is the way I am on and off of YouTube. This is me in my everyday life. I try to lift people up, inspire, encourage them. I do not judge anybody for anything. Because I was not here to judge somebody. I'm no better than you or the next person. I'm just as flawed. We are all flawed. So therefore we have no right to judge. So remember, until I see you next time, you matter to me. Yes, you out there, you're important. I'm speaking to you. Do you see me? I'm talking to you. You matter to me. You out there were uniquely made. And I love you for who you are and what you are. Just the way you are. So until I see you again, I love you. Bye.